Joining us now to discuss this is orthopedic surgeon and team physician for the U.S. ski and snowboard teams, Dr. Robert Parisien. Doctor, great to see you there. Sorry we can't be next to each other in the studio, but travel had other plans this weekend. I want to start with the president, the news rather coming out of the Biden administration from the White House doctor that President Biden has now tested negative for COVID-19. This is a week, of course, after he had that rebound infection.
Yes, exactly. And so I think that, as we discussed many times before, and you've heard from multiple healthcare professionals, that this rebound from Paxlovid is well known and really was expected. And Dr. Fauci had experienced this as well. Initially, they had said that the rates of rebound were very low, but now we've seen that they're probably even higher, maybe 40 to 50% after Paxlovid. So really, his disease process and the virus was suppressed for a period of time. Then he tested positive with that Paxlovid rebound, and then obviously now it's great to see that he's testing negative again. And I presume that he's going to continue to test negative throughout and really be relatively asymptomatic.
When it comes to these rebound diagnoses, what's the average time that people continue to test positive?
That's a great question, and I really don't think that we have the answer for that at this point in time. I think that looking at Paxlovid and the management of these variants, BA.4/5, for example, and really trying to understand the percentage of patients that even experienced the rebound, as I said again, was less, lower percentages initially, and now you're seeing it maybe even higher. So the amount of time now that someone will test positive afterwards, I think we're still learning.
All right. Moving now on to monkeypox, and I'm getting a little bit of feedback in my ear. I'm not sure if you're getting that as well. But when you declare something a public health emergency, what sort of doors does that open in terms of the resources that can be used to fight it?
So several resources become open, and usually it's related to how easily that you can administer and get access to the different treatments that are available. And so if we just remind folks that, monkeypox was largely endemic to Central and Western Africa. It was first discovered in 1970s in humans. We had an outbreak in the United States in 2003 of about 40 to 50 patients. Now we see significantly higher numbers. And so by creating a sort of state of emergency around it, you do have better access, hopefully, to vaccines. However, the CDC does say that there's about 1.5 million people who are eligible for the vaccine, but only about 350,000 or so doses have become available at present.
And let's just go back to the basics for a minute. If you could explain to our viewers what monkeypox is and sort of what is the course of this disease?
So monkeypox, when you are infected with monkeypox, okay, what happens? Well, you have an incubation period of about 5 to 21 days. What does that mean? Well, that means that you're not symptomatic during that period. And during that period, you're also not infectious. Now, following that period, when you're out of that incubation period, you have prodromal symptoms, we call it. Basically, this is where you start to have symptoms. They're flu-like, similar to COVID. You might have a headache, fever, fatigue. And during that period, yes, now you are infectious. Now the blisters are the main portion that everybody is seeing on all the photos and such of the disease. You develop those at the same time or shortly thereafter when you start developing those prodromal flu-like symptoms. And those blisters, I want to remind you, those can be, like, as you've seen all the photos of the patients in Africa, or they can be less than 10 or less than 5. So we need to be very vigilant with this. The course is about a 2 to 4 week course. So you need to isolate during this course because you're contagious. And you can imagine how detrimental that is to someone during their personal and professional life to have to isolate for 2 to 4 weeks. The blisters will then scab over. And when they scab over, they need to actually fall off for you not to be contagious anymore with monkeypox. And so that is the course of disease. Typically self-limiting, less than 1% mortality rate is what we've seen.
This is certainly, I mean, the pictures are gruesome when you look at monkeypox. I mean, there's no way around saying that. And from people that have been interviewed that have had monkeypox, they describe it as being excruciatingly painful. So what would be your message to our viewers today, Dr. Parisien, really quickly before we have to go, about what they can do to avoid it?
Well, you're exactly right. It can be a very painful process. Some of these blisters can be scarring. So really be vigilant and really realize what the high-risk areas are. This really spread via contact, skin-to-skin contact. And so, if I realize if you have someone in your near environment that may be infected with monkeypox, CDC is recommending if you've had 2 sexual partners within the past 2 weeks, or multiple sexual partners within the past 2 weeks, that you may be eligible for the vaccine. And these are different ways in which you're trying to stay ahead of it. But really, it's that skin-to-skin contact that is spreading the monkeypox. Heavy droplets when you're really close, but truly skin-to-skin contact.
Dr. Robert Parisian, we appreciate your expertise as always. Thanks for being here.